Good evening, everyone. This is Meldita, and this is a continuation of our video. Okay, this is implantable cardioverter defibrillator, or ICD. And we have two kinds, the univentricular ICD, utilizing one ventricle, or the biventricular ICD, the so-called CRT-D, utilizing two ventricles. The CRT-D means the cardiac resynchronization therapy defibrillator. So ICD, the plain ICD, has pacemaker from the right ventricle, a cardioverter, a defibrillator. Okay, so we have two drawings in here. We have here a single chamber ICD or a dual chamber ICD. A single chamber ICD, we have here one lead. And this one has two leads. Okay, so this is the ICD generator. Okay, the single lead comes from here and it will pass the subclavian vein, goes to the superior vena cava, passing the right atrium, goes to the right ventricle. The tip is sitting at the apex of the right ventricle. Good bite or good grip for good securement and good contact. And then we have here the ICD lead. The ICD lead has three functions: right ventricular pacemaker, cardioverter, defibrillator. And this is what it looks like here. We have a ventricularly paced rhythm, okay? And usually ICD is used, the patient's ejection fraction is okay, used for VTAC, with or without pulse, okay? And it's used for bradyarrhythmia. It is also equipped with anti-tachycardia pacing. If the rate is fast, the anti-tachycardia pacing takes over. If no good, then if with pulse, cardioversion, sync, and if the patient is pulseless, direct defibrillation. Okay, so the dual chamber ICD here uses two leads. So this is the IC generator. Two leads coming off from the generator. It gets into the subclavian vein to the superior vena cava. Okay, and then two leads get into the right atrium. The right atrial lead will stay. It will be here, the tip at the right atrial appendage. Good grip and good bite again for good contact and good securement. Okay, and that is our right atrial pacemaker. And then the RV lead will proceed to the right ventricle, to the tip at the apex of the right ventricle. Good bite, good grip for good securement and good contact. And this ICD lead has three functions, as I mentioned earlier. It acts as a right ventricular pacemaker, cardioverter, and defibrillator. Okay, and the right atrial lead is our right atrial pacemaker. Okay, and we have here a strip, and this is an atrioventricularly paced rhythm, and it is used for VTAC, with or without pulse. Okay, bradyarrhythmias because we have a pacemaker, and also for tachyarrhythmias, the anti-tachycardia pacing will kick in, hoping that it might solve the problem. If not, if with pulse, the VTAC, then sync cardioversion. If it is with without pulse, then direct, defibrillation. Okay, so about CRT-D, this CRT-D is a biventricular ICD or CRT-D utilizing two ventricles. CRT-D, we have biventricular pacemaker, the right ventricle and the left ventricle. We have cardioversion here, and we have also defibrillation. Okay, so this is my drawing here. So we have here a CRT-D generator, three leads coming off from the generator, carrying all the impulses. It passes the subclavian vein to the superior vena cava. It gets into the right atrium. The right atrial lead gets in. The tip is sitting at the right atrial appendage. Good grip and good bite. And this is our right atrial pacemaker. We have a right ventricular lead going to the right ventricle. The tip is sitting at the apex of the right ventricle. Good grip and good bite, good securement and good contact. Okay, and this right ventricular lead, it acts as a right ventricular pacemaker, cardioverter, defibrillator. Okay, and then we have also a left ventricular lead, and that gets into the coronary sinus, going to this is epicardial at the back of the heart, to the left side of the lateral vein of the left ventricle, and that is on the mid-left, and that is on the mid-left section. Okay, so in here, the coronary sinus is actually an opening that collects all the dirty blood from the heart muscle and delivers the blood to the right atrium. So the whole is going into the right atrium and back again to the usual circulation. Okay, so CRT-D, these are the patients. These patients needed this machine when their ejection fraction is low, less than 30%. They have left bundle branch block, and then they are prone to failure because their EF is low. So usually these are cardiomyopathies. Okay, and they're prone to having, ventricular arrhythmias, VTAC with or without pulse. So they usually insert CRT-D for these reasons. So left bundle branch block, ejection fraction of less than 30%. They're prone to failure. And then this is an anti-failure device. And it is used as secondary prevention. If anything happened, there's already something to deal with the VTAC. So CRT-D, RCD, they do not prevent you from having VTAC, but they deal with the VTAC. Okay, that's it. Plus, we have also to eliminate or treat the other causes. Okay, so here we go. So we have two ventricles. We have the right ventricle pacemaker, left ventricle pacemaker. That's why they call it the biventricular pacemaker. These are the CRT-Ds. With ICD, you have only one ventricle utilized, and that's the right ventricle. So what does the ECG looks like, the strip? Usually in here an example. We have here an atrial biventricularly pace. You have here an atrial pace with depolarization and rupture. We have two spikes before the ventricle. So we have here the two ventricles working good. Okay. And then the question is, what's going to happen if you see this? Okay. So we all know cardiomyopathy patient, they have, their age is, they're getting old. They got more comorbidities, and they are prone to, infections, severe, and more complications. So sometimes in my whole career, I have encountered 4 or 5 times of having all devices, but failed. It's not the device that failed, but the muscle fails. So in here, all the devices are working. So the CRT-D device is working. We have all the pacing working here. Atrial pacing, biventricular pacing, they're all working here, but they are not causing depolarization and capture to the patient. So they're just spikes. They are just spikes. They are not working. So when they're not working, you have no depolarization, you have no capture, you are actually in a systole. Usually patients that we have, the patient and the family and the doctor, they have good communication and updates, and they do what is best for the patient. Okay, now we have also a biventricular pacemaker. It has nothing to do with cardioversion or defibrillation. It is not an ICD, but it has also biventricular pacemaker, the right ventricle and the left ventricle. And there's also a right atrial pacemaker. So I just included this because this is also a biventricular pacemaker. So we call it the CRT-P. So the CRT-D is the cardiac rest synchronization therapy device, and the CRT-P is the cardiac rest synchronization therapy pacemaker. So as you see here, we got one lead to the right atrium. At the tip at the appendage, we have a right ventricle lead. And the right ventricle lead is right ventricle pacemaker. That is your pacemaker. And the left ventricular lead is your left ventricle pacemaker. Getting into the coronary sinus to the left side of the left ventricle to the lateral vein and midsection. Okay, so they're used for, so both of them, the CRT-P and the CRT-D are both anti-failure devices. They're both anti-failure devices. But CRT-P has no defibrillation, cardioversion. CRT-D is for failure, and it has cardioversion and defibrillation and the anti-tachycardia pacing. Okay, and if you look at the strips of this CRT-P here, we have here biventricular pace. So you got spikes, 2 spikes before the QRS.